Dr. McCrindle, what do we know about effective ways to prevent cardiovascular disease?
So the most effective ways there's two approaches actually. The first approach is a population-based approach, which falls mainly in the dominion of public health. And that would be things like adjusting lifestyle factors in the population, shifting trends away from smoking and towards better and healthier eating and getting physical activity. A message for everybody, regardless of what their risk for disease might be. But coupled with that has to be a high-risk individual approach, where you identify individuals with particularly high-risk factors and target them for early intervention.
How can clinicians best impart CVD prevention messages to their patients?
Well, the first thing is I don't think you can start too young to start talking about healthy lifestyle and cardiovascular risk factors. And certainly it is coming up more in the pediatric population where screening should actually start taking place. But most clinicians tend to have difficulty discussing healthy lifestyle with their patients. And it's mainly because it's a difficult area to actually achieve effective behavior change. There are certainly now some new counseling strategies that clinicians can adopt called motivational interviewing, which instead of telling the patient what to do, you actually work with them to target what behaviors they want to target, what's important to them, and also to tap into their own reasons for why they might want to make that change and how they might go about in making that change.
What are some of the obstacles to success in this aspect of medicine?
Well, I think that one of the biggest obstacles is sort of the health environment that we live in. So we're bombarded with messages about fast food, unhealthy eating habits, all kinds of video games, and so our environment doesn't exactly promote a healthy lifestyle to us. And I think that's probably the biggest obstacle why you haven't seen a lot of changes on a population basis.
You've dedicated your career to pediatrics. What's your CVD prevention message for clinicians who care for infants and children?
Well, I think the biggest part of the message is to recognize that kids can be at risk for cardiovascular risk factors, and perhaps the biggest risk factor is for obesity. So it's important for clinicians to actually measure height and weight, calculate body mass index, and plot it on percentile charts, and then not be afraid to have that discussion with a family if the percentiles seem to be getting out of range.
So what's a recommended phrasing that you might use for an adolescent patient, for instance, who might have a BMI of 40, and you have to have that conversation with him and his parents? How do you phrase that?
Well, I think you start off the conversation with the numbers.
Okay.
So you hit them with the facts first, and then you hit them with what the potential implications on their health would be. It's important to work with them and not to make them feel uncomfortable or unfairly targeted, that you're actually working with them to try and get them to achieve a healthier state.